everyone, I'm Marilu Arsenio from St. Augustine School of Nursing, Lipa City. And today, I'm going to demonstrate to you on how to burp a baby. It raises all sorts of questions including how to, when to, and what if there is no burp. How hard do you pat and so forth. Now, I'm going to demonstrate on how a burping technique. Burping your baby is not always easy. Actually, many new parents consider it as a challenge. We're going to demonstrate two burping techniques, over the shoulder and on the lap. We will answer some frequently asked questions. Remember that the reason you burp your baby is to release gas. This is the air that the baby may have taken during a feeding. Babies feel better after burping, and the activity helps stimulate the baby to digestion. For the over-the-shoulder technique, you can either do the sitting or standing. Try them both out and see which works best for you and your baby, or you can alternate sitting and standing. To start, hold the baby up on your chest so the baby is facing toward you with your arm. Tuck under the baby's bottom for support. You'll want to put a burping clothes over your shoulder in case the baby's spit up. Use your dominant hand to gently. But firmly pat your baby's back between the shoulder, working your way up and down. You can also rub the baby's back after several pats. After a while, you get to know your baby. You learn what seems to work best. Keep in mind that breastfeed babies tend to burp less because they take in less air and bottle feed babies. Sometimes babies don't burp at all, which is perfectly normal. Burp your baby for about a minute and then continue feeding. If your baby seems upset and is crying, try standing or rocking your baby or talking to your baby. The second technique is where your baby is sitting on your lap. Placing a burp cloth on your leg. The position looks like this. You can either leg with a baby facing either way. Notice that one hand is holding the baby's jaw. The forefinger and the thumb are used as a sort of wedge, with the palm supporting the chest using firm but gently pressure. Tilt and support the baby's head up a little at first. It may seem a little awkward, but after some practice, it will be a second nature. Remember that it's nothing wrong if the baby does not burp every time. And if the baby spit up, just wipe and continue. Again, use your dominant hand to gently but firmly pat your baby's back between the shoulders, working your way up and down. As we mentioned, you can also rub the baby's back after several pats. One common question parents ask is how often to burp the baby during a feeding. We recommend burping your baby after the baby feeds with each breast. But if you have expressed your breast milk and someone else is feeding the baby, try halfway through and again after the feeding. You may notice that if your baby starts to fuss while feeding, this may indicate the need to burp. Be patient as you learn what your baby needs and likes. Burping your baby is another activity that gives you hands-on contact. As you touch, hold and talk with your baby. All of this adds to the bonding experience. As you gain experience burping your baby will also be a confidence booster for you. After all, there's nothing like experience. That's all, and God bless everyone.